Hello, everyone. Thank you so much for joining us today. This is a webinar that's going to focus on COVID-19 therapeutics, specifically the antivirals. My name is Chelsea Sprouse. I'm a pharmacist at the Virginia Department of Health on the COVID-19 task force. First, we're going to talk about Paxlovid. Paxlovid is used for the treatment of mild to moderate disease in adults and pediatric patients, 12 years and older, weighing at least 40 kilograms. You must have a positive COVID-19 test result and also be at a high risk for severe disease progression. So this would include a high risk of being hospitalized or even death. This product is not meant for those who are hospitalized with severe COVID-19 infection. For the dosing, it comes as two different ingredients in a little dose pack. It's co-packaged with nirmatrelvir 150 milligrams and ritonavir 100 milligrams. The normal dose is 300 milligrams of the nirmatrelvir plus 100 milligrams of ritonavir, dosed twice a day for 5 days. It must be initiated as soon as possible and within 5 days of symptom onset. If you have a patient that has moderate renal impairment, the dose of the nirmatrelvir gets reduced. So that's 150 milligrams of the nirmatrelvir plus 100 milligrams of the ritonavir, still dosed twice a day for 5 days. If you're a doctor sending in prescriptions or if you are a pharmacist, please keep in mind that prescriptions should specify the numeric dose of each active ingredient on the prescription. That's because, your normal community pharmacist, for example, might not have access to all of your patient's records, so they have no idea whether or not your patient has moderate renal impairment. So it's very important to put that numeric dose on the prescription. Also, you want to make sure you instruct the patients that the pharmacist or other healthcare professional will alter their daily blister card just to make sure they receive the right dose. And I have a picture of that on the next slide. For Paxlovid, there are a lot of drug interactions, specifically with CYP3A. So if you have a patient specifically who's taking a lot of medications, make sure that you run a drug interaction checker to make sure that there's no significant drug interactions before prescribing this. With that being said, doctors do have a little bit of a hesitancy prescribing Paxlovid because of these drug interactions. But keep in mind that some of the interactions are things that you can hold, like maintenance medicines, like cholesterol medication, for example. Potentially, you could hold that while the patient's on Paxlovid. Also, you want to use caution if you have a patient with any sort of pre-existing liver conditions. As well, if you have a patient with undiagnosed or uncontrolled HIV, you do run that risk of developing resistance to HIV protease inhibitors. Now, this is the picture of what the blister card is going to look like for Paxlovid. So up here at the top, you'll see the two red circles. So those are going to be the 2 tablets that you pop out for their morning and evening dose. And then it comes with a sticker here where you can put over top of the holes where you popped out the tablets. And that just shows the patient that we did this on purpose to make sure that they get their correct dose. Next, we're going to talk about molnupiravir, which is another oral antiviral. It's used for the treatment of mild to moderate disease in adults only, so 18 years and older, with a positive test result in those at high risk for severe disease progression, again, hospitalization or death. Just like Paxlovid, it's not for use in hospitalized patients with severe infection. The dosing is a little bit simpler for this product. It's 800 milligrams dosed twice a day for 5 days, initiated as soon as possible and within 5 days of symptom onset. It's not expected to have any sort of effect on renal or hepatic impairment. However, there is a black box warning based off of animal reproduction studies for this product. They did show in lab studies that this product may cause fetal harm. So definitely if you have a patient who is pregnant or lactating, you want to make sure you weigh your risks and benefits. If you have a patient with untreated COVID-19, that may cause more harm than treating them. But with that being said, there are other alternatives that can be used other than molnupiravir. So this would be more of a last line agent if you have to use it. The reason it's not authorized for younger patients is because it does have a possible effect on bone and cartilage growth. Lastly, we'll talk about remdesivir. Remdesivir is used for the treatment of COVID-19 in adults and pediatric patients with a positive test result. And this is reserved for those who require hospitalization or those who are at a higher risk for severe disease progression, hospitalization, or death. The dosing for remdesivir gets a little bit more complicated. It was somewhat recently, within the past couple months, approved for outpatient use. So this first slide here is going to show your inpatient use, and then the following slide we have for outpatient use. The most important things to note here is the top box here is for adults and pediatric patients 12 years and older weighing at least 40 kilograms. The thing to note is whether or not the patient is on any sort of mechanical ventilation or ECMO. If they are, their duration of therapy is going to be a little bit longer at 10 days versus if they do not require mechanical ventilation or ECMO, their therapy is only for 5 days. Now, after that 5-day period, if there is no improvement, the treatment can be extended for an additional 5 days. Then if you look at the bottom, the important thing to note is the pediatric patients under 12, it is weight-based dosing, and again, based on mechanical ventilation or ECMO status, would be a 10-day or 5-day course. Then looking at the remdesivir for outpatient use, as you can see, it's a little bit easier as far as dosing goes. But for adults and pediatric patients 12 years and older, the duration of therapy typically is 3 days. And then at the bottom for your less than 12 pediatric patients, it is still for 3 days. And again, it is weight-based dosing here based off of less than 40 kilograms. If they are 40 kilograms or more, they have the standard dosing for 3 days. Some warnings and precautions for remdesivir. Again, it is an injection, so you'll have to monitor your patient for at least an hour after it's complete. If you have a patient who has any sort of renal impairment, it's not recommended if they have an eGFR of less than 30. Hepatic impairment has not been evaluated, and this one also has drug interactions, so just make sure that you run your drug interaction checker again for this product. For the special population, specifically pregnancy and lactating women, there isn't really a whole lot of data, either lack thereof or insufficient data. So the American College of Obstetricians and Gynecologists, ACOG, has created their own algorithm. So if you click on the link there, it goes more in detail with each of the products and which one is preferred and whatnot. In general, the NIH recommends that if you have a potentially effective treatment for your pregnant patient, that treatment should not be withheld because of theoretical concerns. So if there's no proven concern or adverse effect, the NIH really strongly recommends that you don't withhold that potentially effective treatment and just weighing your risks and benefits associated with treating that patient versus having a patient who is untreated with COVID-19. Alrighty, and this slide just shows the efficacy comparison between all of the therapeutics. So in the red boxes are the ones that we discussed today. So Paxlovid, Remdesivir, and Molnupiravir. The other two, bebtelovimab and Evusheld, the monoclonal antibodies, are in a separate webinar. But this does go through in preference based off of the NIH guidelines. So typically Paxlovid and Remdesivir are going to be your first line agents, really just depending on whether or not the patient is hospitalized and how severe their illness is. Then if you look down here at Molnupiravir and bebtelovimab as well, these are more reserved for last line agents, as Molnupiravir is not really effective, at least as much so as Paxlovid. Bebtelovimab, there is really not a whole lot of evidence. They're still in the trials. I believe they are just finished phase 2, but there is not data that has come about after the phase 2 as of now. They did see that there was a 40% relative risk reduction in viral load. That was the most significant of the data. When it came to the risk reduction of hospitalization or death, it really didn't show to be that efficacious against the other products. Then lastly, if you look at Evusheld, the risk reduction for developing COVID-19, since it is for pre-exposure prophylaxis is pretty effective at 83%. Again, you can learn more about these two products, bebtelovimab and Evusheld, in our other webinar. I put this slide in here just for a quick link to physician and patient fact sheets. And I also wanted to bring to your attention this link down here, the ASPR COVID-19 treatment locator tool. You can use that locator tool to find where any therapeutic products might be. I would suggest just calling them ahead of time just to make sure that they have it. But you can use that locator tool to get an idea of where you might find some products. Alrighty, and lastly, I put 2 email boxes on here. These are meant to be provider email boxes, so please don't share those with patients. If you have any therapeutic specific questions, you can send those to COVID-19 Therapeutics at vdh.virginia.gov. Otherwise, any general questions regarding COVID-19, you can send those to COVID Pharmacy Support at vdh.virginia.gov. And thank you so much for your time. Have a good one.